I'm going to talk about menopause and sleep and discuss the two crucial sleep questions that unfortunately sometimes we forget to ask. I have been prompted to do this after NICE released their updated menopause guidance in November 2024, and in their section that discussed sleep, they stated, consider menopause specific CBT as an option for people who have sleep problems in association with vasomotor symptoms. This can be in addition to other management options such as HRT, or for when people have contraindications to these options, or for people who want to try other options. I'd also like to highlight to you another NICE guideline that was published in August 2021, and it's the Obstructive Sleep Apnea Hypopnea Syndrome and Obesity Hyperventilation Syndrome guideline. And what they said was, take a sleep history and assess people for obstructive sleep apnea hypopnea syndrome if they have two or more of these following features: snoring, stopping breathing during sleep, unrefreshing sleep, waking headaches, unexplained excessive sleepiness, tiredness or fatigue, waking from sleep to urinate, choking during sleep, sleep fragmentation or insomnia, and cognitive dysfunction or memory impairment. Can you imagine how many perimenopausal and postmenopausal women experience these symptoms? And if we're not asking, do you snore or do you stop breathing during sleep, we won't know whether someone has two or more of these symptoms. I asked NICE to link their menopause guidance to their obstructive sleep apnea hypopnea syndrome guidance, and unfortunately they said the impact of other conditions on symptoms of the menopause and outcome of sleep disordered breathing for women in transition from perimenopause to postmenopause was not in the scope of their guideline update. And I do appreciate they have to stick within their guideline update. Hence why I'm bringing you this information today. So there are two sleep questions that often we don't ask. So if you learn nothing more from this presentation, please start to consider and ask people who are struggling with sleep, do you snore? Do you stop breathing during sleep? Because sleep disordered breathing negatively impacts sleep. So we are breathing here, we're breathing through a tube here, the airway, and it's actually collapsible. So if somebody completely closes that tube, or it narrows enough that the body feels a threat to life, the body will prioritize breathing, not sleep, and it will take that person out of that stage of sleep and generate a fight-flight response to open that airway. The person may wake up, that's an arousal, or it might be a micro-arousal where the person is taken out of that stage of sleep but is not aware they've been taken out of that stage of sleep. Either way, it fragments the sleep and negatively impacts the sleep. In addition, that person has more fight-flight response running when they're asleep. And what should happen is when we sleep, the fight-flight response should turn down, the relaxation response should turn up, and then the body can do all the wonderful repair processes it's meant to do while we're asleep. And unfortunately, sleep disordered breathing negatively impacts this process. And this is why, from now on, please, we cannot consider sleep without considering how someone is breathing whilst they're asleep. If they're breathing really well during sleep, brilliant. Then you can go on and look at other things to help that person sleep well. This is not new. The sleep medicine world have known about this for over 2 decades. So Dr. Guilleminault, I hope I've pronounced his name correctly, is affectionately known as the father of sleep medicine. So Dr. Guilleminault and colleagues in 2002 published this paper. And they said 83% of postmenopausal women complaining of chronic insomnia had sleep disordered breathing. And they usually had a low apnea-hypopnea index. So that's the current index we use to assess the severity of obstructive sleep apnea. And they questioned the role of sleep disordered breathing in the complaint of chronic insomnia. They produced a part 2 to this paper. And they said abnormal breathing during sleep significantly enhanced complaints of daytime fatigue in postmenopausal chronic insomniacs. And this complaint improved with sleep disordered breathing treatment. And this improvement was significantly better when they compared it to sleep disordered breathing insomniacs treated with a behavioural regime. So what that's telling me, and what I've found my clinical experience of being a GP and a breathing practitioner, is if somebody has sleep disordered breathing, sleep hygiene and cognitive behavioural therapy is not going to work as well as if that person addresses their sleep disordered breathing. I completely agree with everything in the sleep hygiene recommendations, and I know there's lots of evidence for cognitive behavioural therapy. But if we're not asking the question, do you snore? Do you stop breathing during sleep? They're never going to be as good as if their sleep disordered breathing was addressed. And I started to snore in my perimenopause, so I know what it's like to sleep as a snorer with an inefficient breathing pattern, and I know what it's like to sleep now as an ex-snorer with an efficient nasal breathing pattern. And the difference is marked, and this is why I want to raise awareness about this. The Wisconsin Sleep Cohort study has been running since 1988 and particularly is looking at sleep apnea. They published this paper in 2017 in the Menopause journal and stating progression through the menopause is associated with a greater severity of sleep disordered breathing. And this association is independent of aging and changes in body mass index. So we know as people get older and as people gain weight, they're more likely to develop sleep disordered breathing. However, the scientists removed that from the study, and still this progression, this steep rise in sleep disordered breathing as women transition from perimenopause to postmenopause happened. So how we breathe matters. I like to use the 3A's approach. So aware, assess, and action. So first of all, you have to be aware that this concept that how we breathe matters. Just because breathing is generally automatic doesn't mean it's automatically efficient. And hormones affect how we breathe, and how we breathe impacts sleep quality. Women at the 3 hormonal transitions in their life, their breathing can be affected. So at puberty, we have a sex switch in asthma. So before puberty, there is more boys than girls have asthma. And then after puberty, we have more girls than boys who have asthma, and it remains like that through the rest of their life. During pregnancy, there's a steep rise in sleep disordered breathing. And in menopause, there's a steep rise in sleep disordered breathing. So it would be helpful if women were aware of this, and then they could consider how they are breathing. And we've got to think of breathing not in isolation. So obviously in medicine, we divide everything into certain specialities. We have sleep medicine that's looking at how people breathe when they're asleep, and we have respiratory medicine that looks at how we breathe when we're awake. But I find it's slightly strange with my breathing practitioner hat on that we're considering the two separately, because we are a whole person. I think it's highly unlikely that if you're not breathing well when you're asleep because you've got sleep disordered breathing, you're suddenly going to start breathing efficiently whilst you're awake. And I think it's fairly unlikely that if you're not breathing efficiently whilst you're awake, you'll suddenly start breathing efficiently whilst you're asleep. So I like to think of it as a 24-hour breathing efficiency. And we need good methods to assess this. If somebody's sleeping with their mouth open, they've got noisy breathing, they're stopping breathing during sleep, their breathing is not as efficient as it could be whilst they're asleep. And there are questions being asked about whether our current methods of assessment are actually appropriate, in particular for women. But the first thing I want you to be aware of is just be aware that how we breathe matters. And then we can think about, well, what action can we take from this? So with my GP hat on, we generally wait until someone has obstructive sleep apnea and then we treat it. With my breathing practitioner hat on, I see it completely differently. I see this as a spectrum, and I see from my clinical experience of coaching others that the earlier we tackle it, the easier it is to correct. And actually, we probably should start by telling caregivers when a child is born, reminding them that their baby has come into the world as an efficient nasal breather, and give them advice on how to recognise when their child is starting to deviate from how they've been biologically programmed to breathe. And I have a blog post on this on my website that I created with Charlotte, another breathing practitioner. And I want women to know that in those hormonal transitions, their breathing might change. So they might want to take some action before those transitions. I see breathing from a breathing practitioner point of view differently. I see it that we're breathing through a tube that's here in our neck, and the tube at this point is flexible. So what's important, and what I teach on my courses, is we want that tube to be as open as possible. We want it to be as strong as possible. And that involves correct tongue position, nasal breathing, and strengthening the muscles of the tongue and around the throat. And then we've got to think about how much air we're bringing in and out of that small tube. I was over breathing. I was breathing in excess of what my body needed, and I trained my body to breathe the amount it actually needed. I also then strengthened my diaphragm and the muscles in between my ribs, and I also trained my body to breathe slower. And all these things are important to try and get efficient breathing. Now, it won't stop everybody snoring, and it won't stop everybody's obstructive sleep apnea. But there's a workshop report that was created by these individuals here. It's a paper that's been a workshop report that was published, and this was a group of individuals who prescribe and deliver the treatment for obstructive sleep apnea. And their conclusions were that nasal CPAP should be the initial option for most patients. They noted that mouth breathing was common amongst obstructive sleep apnea patients, and also nasal symptoms were common. And actually their nasal symptoms seemed to compromise the adherence to CPAP, which is a form of treatment for obstructive sleep apnea. And they felt it was really important that nasal symptom control was implemented both before and during CPAP use to improve CPAP adherence. And they stated that most studies suggest that nasal CPAP results in more effective treatment and better adherence. So from my perspective as a breathing practitioner, I think it's crucial, the very basic control of sleep disorder breathing is an efficient 24-hour nasal breathing pattern. And we can change how we breathe. So thank you for listening to this. And please, if there's nothing else you remember from this, if somebody is struggling with sleep, just ask, do you snore? Do you stop breathing during sleep? As a GP, I don't think I've missed anyone who's walked in the door and said, I think I stopped breathing during sleep. I refer them for a sleep study. But I have missed people in the past, I'm sure, who've come in complaining of consequences of not sleeping well. So they're fatigued, they're waking with nightmares, they're morning headaches, all these other symptoms that can be a consequence of not sleeping well. And because the individual either hasn't thought about how they breathe when they're asleep or doesn't think it's important, they're not mentioning it to their healthcare professional. When NICE update their obstructive sleep apnea hypopnea syndrome guidelines, I will register as a stakeholder and I will ask them to list menopause as a risk factor. These are my social media handles. I regularly offer zero cost information on there that I hope is helpful. It always comes from a place of kindness and good intention, and I have more information on my website. I also release blog posts reasonably often, and I'm very careful with the information I put in there. I generally reference what I put. So I hope that's been helpful, and please just remember, if we're talking about sleep, please remember to ask those crucial 2 questions. Do you snore? Do you stop breathing during sleep?